All right, welcome back, everyone. I show 1 o'clock on the dot, so we will get started. I hope you all enjoyed your lunch and were able to maybe get out and enjoy some nice spring weather today. This next session I'm really excited about. We've heard a few times this morning already about how housing is a barrier and is for folks reentering society from incarceration. So we are thrilled to have Kelsey Culver and her colleague Sara from the Iowa Balance of State Continuum of Care, sorry. And they're going to explain and share all the great work that they do across our state. So without further ado, Kelsey and Sara.
There we go. Thank you so much for having us here today. I was scrolling through the attendees and I saw some familiar names. So very cool to see some COC participants in the audience. Um, my name is Kelsey. I'm with the Iowa Balance of State. I am the COC Systems Coordinator, and I'm going to share my screen. Um, just a little bit about me. Um, I've worked in this role since July of 2025. And in my role, my big focus is bringing systems together to work towards ending homelessness. Um, some of these things we talk about today might be familiar if you've already heard about housing as a barrier. We're going to share a little bit more about like what the COC is and then our housing problem solving pilot today. So with that, my goal is to reduce barriers for partners and providers to work together and to help streamline our homelessness response system. I've worked in this field for over 10 years, specifically in the Cedar Rapids area, and have experience leading and developing programs for individuals and households at risk of experiencing homelessness. And I've worked in employment programs, street outreach, and housing stability. And I'm going to pass it over to Sara.
Thank you, Kelsey. My name is Sara DeLuna. I am the Grantee Support Specialist for the Iowa Balance of State COC. I've worked with the Iowa Balance of State for not very long, since October of 2025. My role as a Grantee Support Specialist is to assist the grantees who receive funding from the Iowa Balance of State. By whether that be technical assistance, hands-on training, compliance guidance, and just helping programs thrive that are within the Iowa Balance of State. I am based out of Sioux City, Iowa. Um, I've worked within the homelessness housing field for over 7 years, specializing in coordinated entry systems, COC program operations, supporting equitable access, housing resources, and improving the system flow for individuals and families experiencing homelessness. Next slide. The Iowa Balance of State COC, the mission is dedicated to ending homelessness through community collaborations, data-driven strategies, and best practice housing interventions. Next slide. And these are some of the acronyms that we will be using today: ES, SH, Safe Haven, Emergency Shelter, TH, Transitional Housing, SO, Street Outreach, PH, Permanent Housing, PSH, Permanent Supportive Housing, OPH, Other Permanent Housing. And so these are just some of the acronyms that we'll be using today within our presentation. Next slide. Okay. And so what is the COC? We have a little video here. Hopefully it works, of explaining what the COC is.
Not sure the sound is going to come through, so
Okay. So let's go to the next slide because yeah, we can't hear it.
One option is to stop sharing, and then when you go back and share, there should be an option to share with
oh,
sound.
okay. Let
Well,
me, we can skip the video. It will be in the presentation slides, but I put this slide in here just as a backup. So a continuum of care is kind of run through the Department of Housing and Urban Development, also known as HUD. HUD allocates homeless assistance grants to organizations that participate in local homeless assistance program planning networks, which is the COC. It's a lot of words. The COC is made up of representatives from state and local governments and different departments, homeless service agencies, community action agencies, schools, really any system, judicial, corrections, healthcare, and then any interested business or community members. Something we're really focusing on this year is increasing our kind of systems partnerships, just to kind of have more kind of breaking down more barriers across the state. So we work across 96 counties in Iowa to prevent and end homelessness. And our big mission and focus is to make sure people without safe housing can quickly connect to the help that they need. Sara, I think you're unfrozen, so I'll pass it back to you.
Thank you. Leading. So we guide a coordinated statewide approach to addressing homelessness. This includes setting shared goals, using data to understand what is working, and overseeing funding decisions for local housing programs. We also manage the statewide system that tracks services and outcomes to help improve results. Supporting, we organize and implement a local competition to secure funding from the U.S. Department of Housing and Urban Development, HUD, for local organizations, enabling them to provide housing and related services. We offer training, technical assistance, and regular communication to help communities strengthen their work. We also organize the process that connects people to available housing resources. Empowering, we bring partners together to collaborate and solve problems. We create opportunities for community members to get involved, share feedback, and help shape solutions. We advocate for improvements so that people experiencing homelessness have better access to safe, stable housing. And these are the coordinated entry regions within the Iowa Balance of State, minus Woodbury, Pottawatomie, and Polk counties. And so within the Iowa Balance of State COC, we have 9 permanent supportive housing projects, 10 rapid rehousing projects, 3 joint transitional housing and rapid rehousing projects, 6 rural homelessness projects, 6 youth housing projects, and 3 coordinated entry projects. And so this kind of breaks down which counties are located within what coordinated entry regions. Also, next slide. So why partner with the COC? Well, collaboration within other systems of care, including workforce, education, local and state government, judicial, and more. Proactive response based on data-driven interventions. COC programs demonstrate strong outcomes in helping individuals and families achieve stability. Clients served within the COC-funded rapid rehousing projects, there was 1,542 clients served. 85% of clients have positive exits from COC-funded rapid rehousing projects to stable and permanent housing. 686 clients served within the COC-funded permanent supportive housing currently. The COC is the only funding stream for these services. 88% of clients enrolled with permanent supportive housing programs have exits to permanent destinations and are maintaining housing. And that's awesome that they are being exited into permanent housing situations. Coordinated entry. So what is coordinated entry? Coordinated entry refers to the process used to assess and assist in meeting and housing needs of people at risk of falling into homelessness or people who are experiencing homelessness. The CE process helps communities systematically assess the needs of program consumers and effectively match each individual or family with the most appropriate resources available to address that individual or family's particular needs. And Two, the coordinated entry process also um, it prioritizes the most vulnerable. And so that's what we want to prioritize those families and individuals who are the most vulnerable. Coordinated entry also can be a process to connect people in a housing crisis to providers, quickly assess strengths and barriers via a standardized tool, quickly connect people to appropriate services, provide the ability to gain access to the best options to address needs based on client choice. Ensure people with the highest needs are prioritized for the most intensive assistance.
We kind
Next.
of, oh,
Oh,
sorry, Sarah. This isn't on the slide, but we like to describe coordinated entry kind of as a triage. So if you, if you go to a hospital, they're looking for the people with the highest needs who can be served first. And that's kind of how coordinated entry works as well. So I just wanted to share that. I'm trying to figure out how to put that into a graphic, but haven't quite gotten that far yet.
okay. The Iowa Balance of State local competition. Um, we conduct an annual local competition to determine which projects are recommended for federal HUD funding. The Iowa Balance of State Grant Competition Task Group leads this process, evaluating, scoring, and ranking both renewal and new projects based on performance, data quality, alignment with the COC's goals to end homelessness. Grantee participation in the local competition is essential to securing continued federal funding. And so these are just the main 5 steps of the COC grant life cycle. And I will pass it over to Kelsey.
I'm back. So part of the COC, we also have youth-focused initiatives. Most of our housing programs, we're focused for adults, but we recently received Youth Homelessness Demonstration Program, shortened to YHDP, dollars specific for youth aged 18 to 24. So part of this funding is to increase youth voice in programming, offer more housing opportunities, have flexible support, um, kind of incorporate more peer leadership and community collaboration. Um, and I can't remember off the top of my head how many youth programs we have, and I just looked it up. But if you have that question, our contact information is at the end about where our programs are. But some of our initiatives also include rapid rehousing for youth, joint transitional to rapid rehousing programs, youth-focused support services like system navigation, so how to kind of access those more widely available benefits, community collaboration and peer support, and enhanced youth data and evaluation efforts through our homeless management information system to track outcomes and improve our services. Part of our youth initiatives also include having youth action boards across the state. So we currently have three operating, one in progress in Marshalltown, Ames. I think there's one in Des Moines, and then looking at one more in the Eastern Iowa region. They meet virtually to kind of evaluate both COC kind of initiatives and projects, but also agency projects, policies, procedures as well. Just a little plug here. We are a part of a kind of newer organization called the Iowa Homeless Coalition, in partnership with some other housing providers and homeless service providers. This is a new group started in 2025. And the focus is to address the growing number of local and statewide policies that can impact homeless services and our partners. We do have tiered or scaled membership dues based on your organizational size. And anybody can join us in our advocacy efforts. This year specifically, we went to a day on the Hill and talked to legislators about some bills that would negatively impact homeless service providers and also
Okay. The Iowa Homeless Coalition, that is the,
We are working on getting a
okay,
website.
you were frozen.
No. Sarah, where did I cut off at?
I don't remember where you cut off.
It's okay. If you want more information, scan that QR code. Um, So you've heard us talk a little bit about systems of care. Again, those systems of care can be anybody from health providers, law enforcement, first responders, education, healthcare, you name it. We are looking to strengthen those systems of care across the state to support our strategic plan, but also prepare for the future. So every time we get a opportunity to apply for funding, priorities change, and we want to make sure that we have a very robust and healthy system so that we can be flexible and also just prepared to describe the work that we do well. So, our current focus is healthcare, corrections and judicial, and then elected officials at the local, state, and federal level. Um, Across the board, I will be working on all of the systems, but mostly starting with these because healthcare and corrections have shown really strong interest and have kind of the capacity to collaborate in response to this changing landscape that we're working with. Um, but any partnership is key to improving that coordination and outcomes for individuals at risk or experiencing homelessness. And we bring different systems of care together through multiple different um, avenues. So we have a lot of public opportunities for people who are interested in learning more about the COC, interested in partnering with providers. Maybe you want to work with a provider, but you're not really sure like who's in your area. We can support all of that, but we have quite a few things coming up. So we have our annual meeting every second Tuesday. We have coffee with the COC. We have a youth symposium coming up. We have our COC networking events where we bring in partners to share new pilot projects, successes, things that are working. And then some more kind of grantee learning series and YHDP office hours, which are focused on providers, but create a space where people can ask questions, share barriers, and get connected. And I left out housing problem solving because this is a new pilot that I'm really excited to share with you all. Oh, but I added this slide. So there are some corrections and judicial partnerships already happening in Cedar Rapids. So full disclosure, the sixth judicial, I'm not 100% sure if that's still happening. It was when I was working locally, but it was specific to Lynn, Benton, and Jones counties. Correctional officers referred individuals directly to a housing specialist in the area who then completed all the paperwork with them, got them connected to the assessment system, offered case management to help with housing search, resource navigation, making sure people had their basic needs met if they were going to exit into homelessness. And then, if available, once that housing opportunity was identified, they were also able to cover deposit and rental assistance. Oh, thank you, Andrew. I saw you on here, so I appreciate that. So that program is no longer in action, but it was, and it worked really well. So if you want to replicate that in your areas, I'd be happy to chat kind of about how that process worked. In the 7th Judicial District, there's also a permanent supportive housing partnership done with Second Chance Act funding. That is with 7th Judicial District and Humility Homes, and they cover several counties, including Clinton, Muscatine, Cedar, Jackson, Scott, with intensive supervision done by parole officers or probation officers. And then the housing case management is done by Humility Homes. And there's a lot of like intercommunication. So weekly progress emails, monthly case consults. And then Humility Homes kind of handled all the landlord relations and housing search support. The COC specifically has created a partnership toolkit. We have some partners who are reviewing the details for accuracy because we're not experts in everything, but the focus is really to educate partners and bring them into the work of the homeless providers in their area and help set up guidelines or ideas for pilot projects and new partnerships. Specifically, the toolkit is for providers who are looking to partner with corrections and judicial systems, and then we'll share that on our website when it's available. Here we are. So our housing problem solving pilot kind of works into all of the systems of care work that we've been sharing about. Last summer, we were able to do a workshop about kind of incorporating housing problem solving into our area of work. Part of our goal was to reduce the barriers that providers have and reduce the demand for homeless services. So what is housing problem solving? It's a person-centered approach designed to quickly resolve a housing crisis and avoid or rapidly exit somebody from literal homelessness. The kind of big three purposes are to identify a safe housing option for clients, shorten a period of homelessness for a household or individual, and then help connect households and individuals back to their support system. What's important about housing problem solving is that it could be used with any person at any time, no matter where they are in their housing crisis. Some big three words that people have probably heard if you are working with people experiencing homelessness are prevention, diversion, and rapid exit. So it's really important to use housing problem solving in all of those interventions. Prevention is really targeted towards very low income households or individuals who are about to lose their housing and may have or have received an eviction notice. Typically, those prevention programs are associated with funding sources and provide rental or utility arrears. Iowa was really lucky to have some ERA funding come through. So those prevention programs were really strong and robust. I think with the ending of ERA, those programs are not as widely available anymore, which is why you can use housing problem solving to shorten that period or avoid an eviction notice altogether. And diversion is targeted towards households who have fully lost their housing, received an eviction, and are about to enter a shelter or the homelessness response system. The goal of diversion is to find short or long-term solutions to avoid entering shelter altogether. So it could look like a family bouncing from family to family, or a person sleeping with their friend very short term, and then having to go through that diversion process again. Housing problem solving can be a really great tool to help people problem solve their way through that. And then rapid exit is targeted towards households who have already entered the homelessness response system. This could look like somebody who is sleeping in a shelter or sleeping in a place not meant for human habitation, which could be a car, an abandoned building, an encampment in your community. But the individuals who are able to rapidly exit do have the ability to resolve their situation. They may just need more support in problem solving or connecting back to their community. So why are we encouraging people, communities, partners to learn more and use housing problem solving? Our coordinated entry systems are kind of bottlenecked. There's a lot of need for services, and there's not, due to no fault of the providers, there's not a lot of housing opportunities, specifically in more rural areas. So our homeless service providers are at capacity both with their caseloads, but also their funding, which makes being creative very, very difficult. And we know housing costs continue to rise. So housing problem solving is the lowest cost of a housing intervention, followed by emergency shelter and then rapid rehousing. And so our goal through this is to reduce the bottleneck in coordinated entry and reduce the reliance or reduce the, I don't know what word I'm looking for. It escaped me. Reduce the, increase the capacity of our providers, basically. So we want to train our community partners and our community systems to be able to have effective community housing problem solving conversations to reduce the demand and increase capacity. Our goal is that our providers are referring less to coordinated entry and are able to help people self-resolve. So some outcomes and updates since we've launched our training program. Since launching, we've provided training to just 3 community partners. Took us quite a bit of time to kind of figure out the training process, figure out how to track everything, and get connected. But we've shown and gone through this training with one statewide organization and then 2 more regionally focused organizations as well. And on a horizon is we really want to do those more regionally focused.
Those regional focus trainings provide local and relevant resources. Before HPS, 59%. Okay, you had cut off. You had just got cut off. I was right here for the before HPS.
Okay, perfect. I was just yapping about how regional focus trainings work better. So we did a survey with the people who took our training. And before this training or before housing problem solving training, you can see that 59% of people reported they were not familiar or somewhat not familiar with housing problem solving. 73% were not confident in using it in their day-to-day practice with clients. 80% of people had never tried to use a housing problem solving conversation prior to referring coordinated entry. And then 60% of the people we trained referred a person to coordinated entry on a regular basis, which I think was like 1 to 3 times a week. So after that housing problem solving training, this is about 6 months after, 76% of people reported they were familiar or very familiar with housing problem solving. 75% reported that they were confident or somewhat confident in using it in their practice. 88% currently use or plan to use housing problem solving prior to making that coordinated entry referral or sharing that coordinated entry number with somebody. And then that number of referrals to coordinated entry went down to 40%. So what we're seeing is really good movement. Of course, with more providers, we'll have more data to share on an ongoing basis as well. So this is kind of what we wanted to share about, is that we would love to come to your communities, do this training, and help build practical skills to help people resolve their housing crises quickly and creatively. So we focus on housing problem solving as a frontline intervention to prevent and end homelessness. And then our training really focuses on best practices on how to center client choice, how to leverage community resources, how to contact those resources on behalf of a client, as well as some landlord mediation. And then identify immediate realistic housing solutions that are not shelter focused. Who should attend? Again, our focus is really provider partners rather than providers. Of course, if you are a homeless service provider and you want this training, we can provide it to you as well. But we would love to share it more with, or share it with like resource navigators. If you know that you are working with somebody who may experience homelessness or may be at risk of it, we would love to kind of bring that to you. And we can tailor this content to agency needs. If you want to bring a group of people together, we can do that. And we can do in-person or virtual. And just so everyone knows, we offer this like free of cost. So our real goal is just to improve the system. So if you're interested in bringing this workshop or you want to know more, you can contact me directly, and my contact information will be at the end. We went a little bit faster than I expected. So I will feel free to open it with questions. I know there's a couple in the chat. The training is about an hour and a half long. It depends on how much like interactiveness the group gives. So if it's a really quiet group, it doesn't quite take as long, but we try to cap it at an hour and a half. And then Donald, I did see your question. Do I have to be a 501c3 to receive grants? Our funding is specific to housing providers. And you can find more information on our website about what is eligible. Our grant funding gets announced very widely. So feel free to sign up for our mailing lists and follow us on social media. We'll post as soon as we have opportunities open. And Jenny asked, is this training available to organizations across Iowa? Yes, it's open to anybody. It doesn't have to be a homeless provider. It could be, maybe it's a group of businesses who see a lot of homelessness in your area. Maybe you are kind of like homeless adjacent. Anybody in Iowa, we can offer it to you.
Are there any other questions for Kelsey and Sara?
I have one more slide to share quick. If there's no more questions, we are always looking for, I think this, yes. I'm so sorry, I don't know how to pronounce your name, but do I think this training would be beneficial for work release? I think this training could be beneficial for anybody who will be exiting and needing housing support. Thank you all so much again for listening to our spiel and being interested in the COC. We're always looking for community members who may want to be involved. So your agency can be involved in this work by becoming an access point, which is that coordinated entry access into the system. If you are looking for some more like community-centered work or like volunteer opportunities, you could join a task group, volunteer with us, help us make those toolkits, can join us for advocacy days, and then also we do look for donations, but we're willing to take any engagement interested. So please feel free to get connected to us through that.
Well, great. Thank you so much, Kelsey and Sara. And want to give another moment. If there are any other questions, now is your opportunity to throw those in the chat. And while I'm thanking both of you, the important work of what you do, the continuum of care is so important for behind the scenes to make sure that all of our services are coordinated and moving together, and we're serving Iowans in an effective way. So thanks for the work that you do. Thanks for taking time to be here today and share your work with us. And I'm sure you'll get some inquiries from this. We will send out the contact information for Kelsey and Sara and our notes and our wrap up. And again, we are recording this, and this recording will go out as well. So again, thanks, Sara and Kelsey. We'll go ahead and end recording now, and our next session